Today we are going to look at ICU, or the intensive care unit. There are several reasons why one can be admitted in ICU. When you have a problem with your breathing and you're not able to attain saturations of more than 90 to 100. Number two is when you have a reduced level of consciousness, maybe because of an accident or because of a disease or stroke, which is common. And number three is because when you have issues with your cardiovascular system or the heart issues, where we need to support the heart. And during this COVID era, the biggest reason why an individual will have been admitted in ICU is when he or she is not able to attain saturations of more than 90 to 100. Number two is when you are breathing faster than normal. Number three is when you are having difficulty in breathing despite measures taken in a general ward to help you sustain saturations of more than 90. Or when you start having other organs that are not corresponding well to your breathing system, because when your breathing system is affected, other organs tend to be affected too. And some of the organs that might be affected as well are things to do with the kidneys, things to do with the heart, and sometimes you might have things to do when you find your electrolytes that we commonly refer to them as potassium and sodium. They start being either too high or too low. Here we have a machine, and this machine is very important in this COVID era. And this machine will assist you with your breathing. It will give you oxygen from 21% to 100%. So when you're admitted in ICU, we always start with oxygen at 100%. As much as you're breathing, we also try to force in air into your respiratory system to try and recruit some of the cells that have been affected by COVID. So for instance, we are assuming here our patient X, is breathing, and you can see the machine is giving air to this patient at a timed rate, a timed volume, and giving the patient enough time to have a good oxygen and carbon dioxide exchange. This is monitored using lab works. It's monitored using patient saturations, because we are expected to have a saturation of between 90 to 100. And there are certain parameters that will need to be set in relation to a patient. And remember, in ICU, we don't treat the machine, we always treat the patient, because the patient is our main aim of focus. And in ICU, we also look at your cardiovascular system, where we have a cardiac monitor, which will show us an electrical activity of the heart. It will show us your blood pressure, it will show us your pulse rate, it will show us your oxygen saturations. It will also show us how fast or how slow are you able to breathe. And it will also show us your blood pressure at an hourly basis, or as frequent as we may seem to evaluate based on the patient. At times, we might need to sedate and paralyze the patient. This is where we refer to it as a medical coma. A medical coma is when you use drugs, pharmacologic agents, to paralyze, sedate a patient. A patient will be asleep all the time, and this helps us to achieve adequate oxygen saturation, adequate ventilation, and reduce on the metabolic demands of the patient. This will help us to attain a faster or a more progressive approach when dealing with a patient who is having respiratory issues. And in our facility, or in this unit, we have various subspecialties, and it is usually a multidisciplinary approach, where you have a medical officer stationed in ICU, you'll have a nurse intensivist, you'll have a physician stationed in ICU, and we have a dedicated lab for ICU where tests that are requested from ICU are given a priority. And in our facility, we have things like syringe pumps, infusion pumps, ventilators. All these will help us to take care of a single patient. Like, for instance, one may ask, what is different in the ward and in ICU? In the ward, you'll have a normal bed, and you'll have a patient. But in ICU, an ICU bed contains a patient, a monitor, a ventilator, a syringe pump, an infusion pump, and a cardiac monitor as a starter for a patient bed. So that gives you a brief idea of the difference between the ward and the ICU. We welcome you to our facility where we give you adequate, quality, and state-of-the-art patient care in ICU. And it is always our joy to see you walk in ICU and walk out of ICU and come back to say hi to the people who greeted you when you are coming to the facility. Thank you. My name is Nyaga Moffat, intensivist, Bristol Park ICU.